Hi, and welcome to Treating Yourself with FSM. This is Dr. Harlan Mitteg. In this video, I'll explain how frequency specific microcurrent is unique. This understanding should help you to treat yourself more successfully and to get better results. As I said in the first video of this series, FSM devices are unique and quite different from traditional TENS devices. There are only two manufacturers of FSM units in the United States. They are Inspirstar and Precision Distributing, which makes the custom care. There are also a couple people selling Inspirstar units under private labels. Before we learn how to treat with an FSM unit, I'd like to explain the differences between a regular TENS unit and FSM units. Traditional TENS units are used only for relief of pain. The way they do this is based on a well-established understanding of how our bodies register pain. I don't want you to learn all of the details about how we experience pain. There is a simple concept that explains how the body deals with pain. We have pain receptors in most of our tissues, especially in joints. Whenever there is tissue injury or inflammation, this stimulates these pain receptors in our body's tissues. But it is only when these pain signals are transmitted to the spinal cord and then to the brain that we actually experience the sensation of pain. On the top left in the slide where there is the red square and the red horizontal line, this represents the pain receptor and the nerves that carry the pain signals to the brain. There are many other sensory receptors in our tissues as well. Sensations of touch, pressure, movement, hot and cold, and even electrical sensations are all registered in our tissues through a variety of different receptors. These sensations have their own sets of nerves that carry them to the spinal cord and brain so that we can experience them as well. The green square and green horizontal line in the graphic represents these receptors and their nerves. You'll see on the right side of the graphic an arrow pointing up labeled gate. When all of these different nerves, the pain nerves and also the nerves carrying the other sensations, when they all enter the spinal cord, they connect to another set of nerves. This second set of nerves carries the signals up the spinal cord and to the brain. We call this location where the nerves from the outside, from our tissues, connect in the spinal cord, the gate. It's a gate because it only lets a fraction of the nerve impulses from the nerves coming in through. There is not enough bandwidth to carry all of the signals that are coming in up to the brain. All of the sensations coming from the tissues, sensations of pain, pressure, hot and cold, movement, even electricity, are competing with each other to get through that gate at the spinal cord up to the brain so that they can be experienced. If you increase the amount of other stimuli trying to get up the spinal cord to the brain, you experience less pain. It's not that there are fewer pain signals being generated by the injured tissue. It's that you are preventing those signals from reaching the brain, so you don't feel them. That's how a TENS unit works. It overstimulates the nerves that are competing with the pain nerves. This is the reason that when you use a TENS unit, you turn up the current intensity so that you can really feel it. It's also why the relief that you get from a traditional TENS unit is short-lived. The relief doesn't last very long after you stop the stimulation. Pad placement or electrode placement for a traditional TENS unit to relieve pain is always on the skin directly over or immediately around the painful area. This way you are overstimulating the nerves and blocking the pain signals from getting up to the brain. Now that you understand the basics of how a traditional TENS unit works, let's look at FSM and how it's different. On the surface, they look pretty much the same. Frequency specific microcurrent is a resonance therapy. Frequency specific microcurrent is operating on a different set of principles than the traditional TENS. The first principle is that of resonance. Resonance is based on the idea that everything has a unique frequency or vibration. On the left, you see Dr. McMakin's book on frequency specific microcurrent. She named her book, appropriately, The Resonance Effect. In the middle, with the tuning forks, you see a common experiment that demonstrates the phenomenon of resonance. One tuning fork can stimulate the other tuning fork if they are both tuned to the same note. If it's not the same note, the second tuning fork doesn't respond at all. Then on the far right is the phenomenon wherein you can break a crystal glass by exposing it to the exact frequency that resonates to the quartz of the crystal. The quartz begins to absorb the energy of the sound frequency, starts vibrating, and then the glass shatters. The point here is that structures, even molecules, tissues, and organs, have unique frequencies. This means that we can connect to different tissues and organs if we have the right frequency. Perhaps a better way of saying it is that we can talk to different tissues and organs through their resonant frequency. The first part of resonance therapy, then, is being able to connect to the specific body structures through their resonance frequencies. The second aspect of resonance therapy that we use in frequency-specific microcurrent is the discovery that specific frequencies can change body functions in different ways. An example is the frequency 40 Hz. You'll find numerous articles online about the beneficial health effects of 40 Hz. 40 Hz means a frequency of 40 pulses per second. This could be a sound that is at 40 Hz. To our ears, 40 Hz is a very deep bass tone. Or it could be a light that is pulsing 40 flashes a second. Or, as in the case of FSM, it is an electrical current that is pulsing 40 times per second. I'm using the 40 Hz here as an example of a frequency that affects specific functions in our body. And in this experiment, it shows how 40 Hz affected functions in the brain. The slide shows the results of some animal experiments using the 40 Hz frequency. On the far left, you see the slice of a mouse brain that has Alzheimer's disease. And one of the characteristic marks of Alzheimer's is amyloid plaques, deposits in the brain made of amyloid. These are characteristic of Alzheimer's. Also in that cross-section of the brain, you see glial cells, and the heading says that these glial cells are at rest, meaning they're not doing their ordinary job, which is to clean up and get rid of the debris, like the amyloid plaque of Alzheimer's. As a result, the amyloid plaques have accumulated, and this eventually causes the brain dysfunction that we call Alzheimer's. In the image on the far left, you can also see what is labeled as normal gamma waves. This is referring to a brain wave called a gamma wave. We have a number of different brain waves of different frequencies that oscillate in our brain. A gamma wave is defined as a pattern of neural oscillation in humans with the frequency between 25 and 140 Hertz. So 40 Hertz is within the range of gamma waves. 40 Hertz would be a gamma wave when it comes to the brain. In the second image from the left, you see the squiggly line showing the stimulation of the brain with 40 Hertz light or sound stimulation. So that's coming in from the outside, and the brain matches that frequency, or that frequency coming in from the outside increases the gamma waves in the brain. And in the experiment, what they did was expose mice with Alzheimer's disease to 40 Hertz light and sound, and what they found was that the 40 hertz frequency activated the glial cells so that they started working again, and they began removing the amyloid plaques that were behind the Alzheimer's. After being exposed to the 40 hertz light and sound for a while, the mice had their brains cleaned up, and they began to behave like normal mice. That is, like mice that didn't suffer from Alzheimer's disease. The 40 hertz treatment has also been repeated in humans with similar results. So in this case, you have exposure to a frequency, 40 hertz, affecting the function of a key cell in the brain, the glial cells. In frequency specific microcurrent, we use two frequencies at once. One of the frequencies sets up a carrier wave, which allows communication with specific structures, that is, specific cells, tissues, organs, or organ systems. The other frequency, which is pulsed at the same time, carries a message or talks to the targeted tissue and asks it to do something. By asking it to do something, I mean that the frequency stimulates the structure being connected to make some type of change. On the last slide, I showed research into the 40 hertz frequency and how it stimulated the cleanup of Alzheimer's disease lesions in the brain. Here's an experiment where 40 hertz was used in combination with 10 hertz. In FSM, 40 hertz is understood to reduce excessive inflammation and/or to reduce the activity of a tissue, organ, or organ system. 10 hertz resonates with the spinal cord. On the left side of the slide is the report on an experiment with FSM using these two frequencies. Researchers treated 54 patients with chronic pain or fibromyalgia that began after trauma to the neck. When researchers simultaneously ran two currents pulsing at 40 hertz and 10 hertz, they saw a profound reduction in key inflammatory chemicals in the body. Specifically, they measured reductions in the cytokines IL-1, IL-6, TNF-alpha, and the neuropeptide substance P. These are chemicals that promote inflammation in the body. They are called cytokines, and they're signal molecules that are secreted by the immune system. Many of the cytokines, again, promote the inflammation that is the root cause of chronic pain. The people in the experiment were asked to rate their pain levels from 0 to 10, 0 being no pain, 10 being unbearable pain. The average pain level for the 54 patients in the experiment before their first treatment was 7.3 out of 10. The average pain level after the first treatment was 1.3 out of 10. So pain levels dropped from 7.3 to 1.3 with just one treatment. For most of the subjects, it took about 90 minutes of treatment for them to get these results. On the right here, you see a patient set up with the towel electrode on the back of their neck and then another electrode at their ankles. So the current was passing through their entire body, the 40 hertz and the 10 hertz, both at the same time. You can see an FSM machine on the cart behind the patient. This is a clinic model made by Precision Distributing, but it is essentially no different than the InspireStar models or the Custom Care. It has a few additional features, but the output, the current that comes out of the machine, is no different than what comes out of the InspireStar units or the Custom Care. So far, we've seen the difference between traditional TENS and FSM in the treatment of pain. We've seen that both can reduce pain, but they do it in a very different way. Traditional TENS temporarily blocks the transmission of pain signals to the brain so that we don't feel as much pain while we're being treated. FSM treatments, as demonstrated with the 40 hertz and 10 hertz treatment, send signals to our body's tissues to stimulate changes in the tissue that endure. We saw that there was a lowering of the inflammatory chemicals in the body as a result of the treatment. The paragraph on the slide is from the report on this last experiment, and I quote, 58%, 31 out of 53, of the study subjects experienced resolution of fibromyalgia symptoms, including improved tender point sensitivity and sleep quality following a period of ongoing office treatment and home care. So not only did it lower the pain immediately after the treatment, in many of the subjects that were treated, they had complete resolution of the condition. One thing that is very important for healing of cells, tissues, and organs is energy. Cells require energy in order to function correctly. They get this energy from a molecule called ATP, which is produced by burning fat or sugar. On the left is a graphic that shows this process, and you can see the ATP molecules that are produced. Researchers have shown that stimulating cells with microcurrent increases their production of ATP. This is very important for healing since cells need this energy supply in order to accomplish healing. So with FSM, in addition to signaling cells, tissues, and organs to shift in specific ways, the microcurrent itself stimulates the production of cellular energy to energize this process. There is another important point to be made here, and that is that this effect is only true of microcurrent. In microcurrent therapies, the amperage of the current is very small. It's measured in microamps, or millionths of an amp. Most treatments are done between 40 and 200 microamps. Only this intensity of current will increase ATP production within cells. Other therapies, like a traditional TENS, use much higher intensity current in the range of 80,000 microamps. So there is no enhancement of ATP production with these higher intensity devices like a normal or traditional TENS unit. So far I've talked about relief of pain with FSM. It's important that you appreciate that FSM, the frequencies of FSM, also target many other structures in the body. So FSM is able to treat many different organs, tissues, and functions of the body. And this is the top of a list of frequencies used in FSM, frequencies that resonate to different structures. So the frequency for adipose or fat tissue is 97 hertz. The adrenal cortex, the outside of the adrenal gland, is 71 hertz. The medulla of the adrenal is 315. Arteries are 99 hertz. Blood is 103 hertz. Blood vessels as a whole, including all of the arteries, veins, and capillaries, is 105 hertz. Bones has two frequencies, 39 and 59. And the list goes on and on for many, many different tissues, structures, organs, and organ systems in the body. One example of FSM treating other things other than pain is macular degeneration. Here is a research study that documented the benefit of FSM in the treatment of macular degeneration. People often ask, how long does it take for FSM to work? A couple of slides ago, I showed you how treatment with the 40 hertz, 10 hertz combination lowered fibromyalgia pain levels from 7 to 1 in 90 minutes on average. In the first video of this series, I showed you the case of Terrell Owens, the football player with a broken ankle. His medical doctors told him it would take 13 to 18 weeks to recover from his surgery, and yet with constant FSM treatments, almost 24/7, on his ankle after the surgery, he was able to play in the Super Bowl just 6 weeks after his surgery. FSM typically speeds up healing times and provides relief where other therapies may not be able to do so. The timing is very individual. It depends on the severity of a condition, the chronicity, how many years or months it has been going on, and how much tissue damage there is, and also the resources that the body has to heal the lesions or the problem. Remember that FSM works by signaling the body to orient itself to the repair area. If the body is lacking resources to repair that area, then it takes longer. FSM augments other approaches, meaning FSM works in tandem with and alongside other approaches. It can work very well along with other healing approaches. Here's an example of why. Imagine that you have extreme tiredness, a lack of energy, you're feeling pins and needles in your limbs, your tongue is red and sore, you have mouth ulcers, you have muscle weakness, slight disruption of vision, and you're experiencing psychological difficulties, things like depression or confusion, and you're also having problems with memory, with understanding things, and with making good judgments. All of these symptoms are symptoms of vitamin B12 and folic acid deficiency. No amount of FSM treatment is going to reverse a vitamin deficiency. If you are deficient in vitamins, minerals, or other nutrients, you need to make sure you get those into your diet or through supplements. Once you have corrected the nutritional deficiency in this case, then frequency-specific microcurrent will help speed the healing response to help you recover from all of the symptoms of this deficiency. So don't turn your back on other therapies just because you're doing FSM. A major prerequisite for successful treatment with FSM is to be well hydrated. FSM works by pulsing electrons through tissues, and electrons cannot flow easily through dry or dehydrated tissues. So it's important to drink lots of water and avoid overconsumption of caffeinated drinks before treatments. There are some cautions with FSM treatment. Here are some of them. Do not use FSM in the area of a pacemaker. If someone has a pacemaker, you can treat the neck with current going through the neck only or below the rib cage. Do not treat anyone who has an internal pump for delivery of medication unless the pump is turned off. Do not treat anyone with a spinal cord or deep brain stimulator unless the stimulator is turned off. Do not treat anyone who has a hospital monitor or cardiac monitor, as the currents of the FSM could interfere with the monitor. Do not treat a woman who is pregnant. And finally, do not treat anyone below the age of 18 except to speed the healing of injuries or wounds, or when under the active participation and management of their doctor. With regard to electrode placements, do not run electrical currents through the brain or eyes. Do not use FSM when you are sick with an infection. So, for instance, if you had a toothache that was being caused by an infection and you tried to lessen the pain with certain frequencies, those frequencies might help improve the pain, but in the meantime, that might help the microbes to spread. So you want to be sure if you're sick that you're under the care of a doctor who is managing the infection either with antibiotics or antimicrobials or whatever is appropriate. And then do not use FSM to treat any illness without first consulting your doctor. Here is a podcast by Dr. McMakin. Dr. McMakin, as I said in the last video, is the modern-day champion of frequency-specific microcurrent. We really have her to thank for our access to FSM today. Without her, we would never have seen or heard about frequency-specific microcurrent. That's it for this video. In the next video, I'm going to talk about the mechanics of FSM treatments. I'll discuss electrode placement, how you sequence treatments, how to get the best results with your treatments, and other resources that you could use.